you have the floor, and we'll go to the question period after.
Thank you, Steve. Good morning. Thank you for joining us today. Before I begin, I'd just like to acknowledge Canada is the homeland of First Nations, Inuit, and Métis people, and that we are gathering in Ottawa on the unceded traditional territory of the Algonquin. Today I'm here to talk to you about Health Canada's authorization of the new Moderna Spikevax COVID-19 vaccine targeting the Omicron XBB 1.5 subvariant. We've authorized this vaccine for people 6 months of age. The vaccine was authorized after an independent and thorough scientific review for safety, efficacy, and quality. And this included a review of data from several studies of primary series and booster doses of the Spikevax vaccine collected through the past. After assessing all the data, we've concluded that there is strong evidence showing that the benefits of this vaccine outweigh the potential. Individuals who are 5 years of age and older should receive 1 dose of the vaccine, regardless of the COVID-19 vaccine. And children between 6 months and 4 years of age should receive 2 doses. They have not previously been vaccinated with the COVID-19 vaccine. And if they have been previously vaccinated with 1 or more doses, they should receive a single dose. This vaccine is anticipated to provide a robust immune response that will be effective against Omicron XBB 1.1 variant. Health Canada is also actively reviewing submissions from Pfizer, BioNTech, and Novavax seeking authorization of the respective XBB 1.5 COVID-19 vaccine. These submissions are being reviewed on a priority basis by dedicated scientists. Timing for the completion of these reviews depends on many factors. We will make decisions once we have thoroughly evaluated all of the requirements. Health Canada continues to use rigorous, independent scientific processes to ensure all health products meet our stringent requirements for safety, efficacy, and quality before allowing them. And as with all of Health Canada's vaccine and drug authorizations, we want to stress that we only examine robust scientific evidence, trusted and reliable. We recognize that there's an abundance of information available, sometimes false and exaggerated. We encourage people to consider their sources of information. As we did with all our COVID-19 vaccines, we're publishing a number of documents about this decision, including the Canadian Product Monograph and the Regulatory Decision Summary, which provides a high-level summary of the evidence that we reviewed. All of this information is available on the Government of Canada's main COVID-19. Health Canada and the Public Health Agency of Canada will monitor for any adverse events in collaboration with territories, international partners, and manufacturers. As with all vaccines, we will take action if any. Today's authorization provides people in Canada with more protection against COVID-19. I know we all wish COVID-19 was not. People are still getting infected, and vaccination continues to be one of the most effective ways to protect ourselves against serious illness, including severe illness, hospitalization. Vaccine protection increases over time, which means many of us are due for another dose. Receiving a shot of the new formulation will help protect people against the variants circulating currently and expected to circulate through the fall. Thank you.
Bonjour, merci de vous joindre à nous aujourd'hui. Avant de commencer, j'aimerais souligner que le Canada est la patrie des Premières Nations, des Inuits et des Métis, que nous sommes réunis à Ottawa sur le territoire traditionnel non cédé du peuple algonquin Anishinaabe. Aujourd'hui, je suis ici pour vous parler de l'autorisation de Santé Canada concernant le nouveau vaccin Spikevax de Moderna contre la COVID-19 qui cible le sous-variant Omicron XBB.1.5. Nous avons autorisé ce vaccin pour les personnes de 6 mois et plus, à la suite d'un examen scientifique indépendant et approfondi de son innocuité, de son efficacité et de sa qualité. Cette évaluation a notamment porté sur les données de plusieurs études sur la vaccination primaire et les doses de rappel de vaccin Spikevax qui ont été recueillies au cours des 2 dernières années. Après avoir évalué toutes les données, nous avons conclu qu'il existe des preuves solides montrant que les avantages de ce vaccin l'emportent sur les risques. Les personnes de 5 ans et plus devraient recevoir 1 dose du vaccin, quels que soient leurs antécédents de vaccination contre la COVID-19. Les enfants de 6 mois à 4 ans devraient recevoir 2 doses s'ils n'ont jamais été vaccinés contre la COVID-19. S'ils ont déjà reçu 1 ou plusieurs doses, ils devraient recevoir 1 seule. Ce vaccin devrait fournir une forte réponse immunitaire efficace contre le variant Omicron XBB.1.5. En outre, Santé Canada examine activement les demandes d'homologation de Pfizer-BioNTech et de Novavax pour leur vaccin contre la COVID-19, ciblant le variant XBB.1.5. Ces demandes sont examinées selon les priorités par des équipes scientifiques spécialisées. Le moment où ces examens seront complétés dépend de nombreux facteurs. Nous prendrons des décisions une fois que nous aurons évalué en profondeur tous les renseignements pertinents. Santé Canada continue d'utiliser un processus scientifique rigoureux et indépendant pour s'assurer que tous les produits de santé répondent à des exigences strictes en matière d'innocuité, d'efficacité et de qualité avant d'autoriser leur mise en marché. Comme c'est le cas pour toutes les homologations de vaccins et de médicaments de Santé Canada, nous tenons à souligner que nous n'examinons que des données scientifiques solides provenant de sources fiables et dignes de confiance. Nous savons qu'il existe beaucoup de sources d'informations sur le sujet, dont certaines font circuler de fausses informations ou des exagérations. Nous invitons les gens à évaluer soigneusement la crédibilité de leurs sources d'informations. Comme nous l'avons fait avec tous les autres vaccins contre la COVID-19, nous allons publier un certain nombre de documents sur cette décision, notamment la monographie canadienne et le sommaire de décisions réglementaires, qui fournit un résumé détaillé des données examinées. Tous ces renseignements sont disponibles sur le site Web principal sur la COVID-19 du gouvernement du Canada. Santé Canada et l'Agence de la santé publique du Canada effectueront le suivi des effets indésirables qui pourraient se manifester en collaboration avec les provinces et les territoires, les partenaires internationaux et le fabricant. Comme pour tous les vaccins, nous allons prendre des mesures si tout nouveau problème d'innocuité est mis au jour. L'autorisation d'aujourd'hui fait en sorte que la population canadienne sera davantage protégée contre la COVID-19. Je sais que nous aimerions tous et toutes que la COVID-19 soit chose du passé, mais le virus continue d'infecter les gens. Et la vaccination demeure l'un des moyens les plus efficaces pour nous protéger contre les conséquences graves, y compris les complications de la maladie, l'hospitalisation ou la mort. La protection vaccinale diminue avec le temps, ce qui signifie que plusieurs d'entre nous devraient recevoir une nouvelle dose. Recevoir le nouveau vaccin aidera à protéger la population contre les variants qui circulent actuellement et qui devraient circuler à l'automne et à l'hiver. Merci.
Bonjour à toutes et tous. Today, I will provide an update from the National Advisory Committee on Immunization, or NACI, on the use of COVID-19 vaccines this fall and an overview of our expectations for the upcoming respiratory virus season. For today's authorization, NACI is reaffirming its guidance on the use of COVID-19 vaccines this fall. NACI recommends authorized age groups get an updated COVID-19 vaccine dose this fall, 6 months after the last vaccine dose or infection. Provinces and territories will be providing additional information on COVID-19 and seasonal flu vaccine availability in their respective regions. We will have enough supply of the updated COVID-19 vaccines to support immunization programs across Canada. From the start of 2023, COVID-19 indicators have been on a decline to historically low levels for a number of months. In the last few weeks, we have started to see an increase in COVID-19 indicators across many areas of the country, including hospitalization. The Omicron variant continues to evolve, with XBB subvariants such as EG.5 continuing to circulate in Canada and globally. Canada has also reported 11 cases of the Omicron subvariant BA.2.86. Here's some good news. Preliminary clinical data have shown promising immune responses from the XBB.1.5 vaccine, the vaccine receiving regulatory authorization today, against various Omicron sublineages, including EG.5 and BA.2.86. This improved immune response is expected to better protect against the strains that are circulating in our community. It has been more than 6 months since your last dose of COVID-19 vaccine or your last infection, your protection from the virus may have waned. Receiving a COVID-19 vaccine dose this fall with an updated formulation is expected to increase individual protection against infection, symptoms, and severe disease. This is particularly important for people at increased risk of severe outcomes, such as people 65 years and older, individuals with underlying medical conditions, pregnant people, and those living or working in congregate living settings. Vaccination, in combination with personal protective measures, are integral tools to reduce the negative impact of respiratory illnesses. This is especially important as we head into the colder months, when people spend more time indoors and the risk of respiratory illness increases. Last year, Canada experienced an early and intense influenza season during a time of high circulation of the respiratory syncytial virus, or RSV, putting increased strain on already stressed healthcare systems, particularly the pediatric healthcare system. It is difficult to predict what will happen this fall and winter regarding the co-circulation of influenza, RSV, and COVID-19, given that it is still early in the season. But the good news is we can get prepared and protect ourselves in case simultaneous surges of respiratory viruses occur. This is why receiving a COVID-19 vaccine dose, as well as a flu shot this fall, is especially important. It is safe to receive COVID-19 and flu vaccines at the same time. These vaccines will help to keep us from getting seriously ill and, by extension, reduce the burden on our health systems. Treatments can also help reduce serious illness posed by COVID-19. The Government of Canada is funding Can Treat COVID, a clinical trial with sites across Canada to evaluate treatments like Paxlovid for acute COVID-19 infection. You can find out more information at cantreatcovid.org. Everyday personal protective measures, such as staying home when sick, cleaning your hands frequently, properly wearing a well-fitting mask or respirator, and improving ventilation as possible, remain effective strategies to reduce the spread of respiratory viruses, especially when combined with vaccination. With children now back in school, check to make sure their routine vaccines are up to date for their age. Immunization remains the number one action we can take to protect children from serious infectious diseases. For older adults, it's important to remember that during the fall and winter months, people over the age of 65 are at greater risk for other infections too, like bacterial pneumonia. So if you're in this age group, now is also a good time to discuss getting the pneumococcal vaccine with your healthcare provider. With these tools in mind, I encourage everyone to take action to stay safe this respiratory virus season. Merci. Thank you. Megwit.
Bonjour à toutes et à tous. Je présenterai aujourd'hui une mise à jour provenant du Comité consultatif national de l'immunisation, ou CCNI, sur l'utilisation des vaccins contre la COVID-19 cet automne, ainsi qu'un aperçu de nos prévisions pour la saison des virus respiratoires qui approchent. Avec l'autorisation d'aujourd'hui, le CCNI réitère ses recommandations concernant l'utilisation des vaccins contre la COVID-19. Le CCNI recommande que tous les groupes d'âge autorisés reçoivent une nouvelle dose de vaccin contre la COVID-19 cet automne, 6 mois après leur dernière dose ou une infection à la COVID-19. Les provinces et territoires communiqueront des renseignements additionnels sur les disponibilités des vaccins contre la COVID-19 et la grippe saisonnière dans leurs régions respectives. Nous disposerons d'une quantité suffisante de nouveaux vaccins contre la COVID-19 pour soutenir les programmes de vaccination partout au Canada. Depuis le début de 2023, les indicateurs de COVID-19 ont atteint des niveaux historiquement bas, et ce, pendant plusieurs mois. Au cours des dernières semaines, nous avons commencé à détecter une augmentation des indicateurs de la COVID-19, comme les hospitalisations dans plusieurs régions au pays. Le variant Omicron continue d'évoluer avec des sous-variants XBB tels que le E.5 qui demeure en circulation au Canada et dans le monde. 11 cas de sous-variants Omicron EA.2.86 ont également été signalés au Canada. Les données cliniques préliminaires montrent des réponses immunitaires prometteuses avec le vaccin contre le sous-variant XBB.1.5. La nouvelle formulation du vaccin autorisée aujourd'hui contre divers sous-variants, notamment le EG.5 et le BA.2.86. On anticipe que cette réponse immunitaire améliorée procure une meilleure protection contre les souches qui circulent présentement dans différentes régions du pays. Si plus de 6 mois se sont écoulés depuis votre dernière dose de vaccin contre la COVID-19 ou votre dernière infection au coronavirus, il se peut que votre protection contre le virus ait diminué. Le fait de recevoir cet automne une dose de nouveau vaccin contre la COVID-19 devrait augmenter votre protection contre l'infection, les symptômes et les complications découlant de la COVID-19. Cette mesure est particulièrement importante pour les personnes plus susceptibles d'être gravement malades en raison de la COVID-19, comme les personnes âgées de 65 ans et plus, les personnes atteintes de maladies sous-jacentes, les personnes enceintes et les personnes qui vivent ou travaillent dans des milieux de vie collectifs. La vaccination et les mesures de protection individuelle sont des outils essentiels pour réduire les effets négatifs des maladies respiratoires, qui sont particulièrement importants à l'approche des mois plus froids, où les gens passent plus de temps à l'intérieur et où le risque des maladies respiratoires augmente. L'année dernière, le Canada a connu une saison grippale précoce et intense pendant une période de propagation élevée de VRS, mettant à rude épreuve les systèmes de santé déjà très sollicités, en particulier le système de soins pédiatriques. Il est difficile de prédire comment se dérouleront l'automne et l'hiver prochains en ce qui concerne la propagation de la grippe, du VRS et de la COVID-19, étant donné que la saison ne fait que commencer. Mais heureusement, nous pouvons nous préparer à l'éventualité des vagues simultanées du virus respiratoire pour nous protéger. C'est pour cette raison qu'il est particulièrement important de recevoir une dose de vaccin contre la COVID-19 ainsi qu'un vaccin contre la grippe cet automne. Il est en effet sécuritaire de recevoir ces deux vaccins en même temps. Ces derniers nous aideront à ne pas tomber gravement malade et, par conséquent, à réduire les pressions exercées sur nos systèmes de santé. Les traitements peuvent également contribuer à réduire la gravité de la COVID-19. Le gouvernement du Canada contribue au financement Can Treat COVID, un essai clinique comptant plusieurs sites à travers le pays qui a pour but d'évaluer des traitements pour l'infection aiguë à la COVID-19 tels que Paxlovid. Vous trouverez plus d'informations sur le site cantreatcovid.org. Les mesures de protection individuelles, comme rester à la maison lorsqu'on est malade, se laver les mains fréquemment, porter un masque bien ajusté et améliorer la ventilation autant que possible demeurent des stratégies efficaces pour réduire la propagation des virus respiratoires, en particulier lorsqu'elles sont combinées à la vaccination. Maintenant que les enfants sont de retour à l'école, assurez-vous que leurs vaccins de routine sont à jour en fonction de leur âge. La vaccination demeure le meilleur moyen de protéger les enfants contre les maladies infectieuses graves. Quand une personne âgée de plus de 65 ans, il est important de se rappeler que pendant l'automne et l'hiver, elles sont plus à risque de contracter d'autres infections comme la pneumonie bactérienne. Si vous faites partie de ce groupe d'âge, il serait bon de discuter de vaccins contre les pneumocoques avec votre médecin. En conclusion, j'encourage tout le monde à prendre les mesures de prévention des infections pour rester en sécurité pendant la saison des virus respiratoires. Merci. Thank you. Miigwech.
I believe it's time for questions. So we'll go first in questions in the room. I recognize two reporters, and then we'll go on Zoom. Vous pouvez utiliser la fonction lever la main à partir de maintenant pour avoir le micro. So we'll go first with Mia Rapson, Canadian Press.
Good morning, afternoon, whatever time of day it is today. I'm just wondering, Dr. Tam, if you can give us some more information on the current situation with COVID. We've heard about this uptick. where are we at sort of in comparatively? And are the vaccines now going to come at a time that will actually help this fall? Or by the time we actually get them into arms and they take effect, will it be too late to slow whatever wave we're seeing right now? I'm just wondering, Dr. Tam, if you can give us some more.
Yeah, so right now, we have been seeing this uptick of COVID-19 activity in wastewater in some areas of the country, but that's a little unstable. It's gone up, and then in some areas it's come down as well. So, but overall, the COVID indicators are still at quite low levels and low to moderate in some areas. So we're just at the beginning, I think, of this fall winter circulation. So it's not too late to get COVID-19 vaccine and the flu shot, even throughout the season, particularly as we're trying to prevent serious outcomes as well.
Thank you. And I'm going to put a whole bunch of questions into this one. So, are you able to get this vaccine at the same time as the flu shot? Is that something that would be recommended or possible? Do we know if they will still be free or if some provinces are going to have to make that decision? And also, in terms of uptake, the bivalent uptake was relatively low compared to the original or the primary series. What are we trying to do to overcome that? And what do you think can overcome that?
Thank you. So the provinces and territories, for the most part, are planning to be able to provide both vaccines at the same time. And so that may increase access and uptake, make it more convenient for people. So one visit, two vaccinations at the same time. And as I've said in my opening remarks, it is safe to provide both vaccines at the same time as well. And in terms of some of the data that we have on surveys that we conducted on vaccine coverage, as well as on public opinion surveys as well, is that one of the reasons, for example, that people didn't get the flu shot was because it was kind of inconvenient for them, and they didn't get around to it, was one of the reasons. And so if we are essentially in the jurisdictions trying to link up both vaccination program, it may just make it a little bit easier. Of course, long-term care facilities and other high-risk settings will likely be the focus for the initial provincial territorial programs, just as they do with influenza vaccines. And I think provinces and territories will be providing further information on the start dates of those programs. And so you should check in with your local jurisdiction. The federal government is continuing to provide the COVID-19 vaccine. We are also providing support for the high-dose influenza vaccine for long-term care.
Following up with Marina.
Dr. New, maybe I could just add points in terms of the issue of vaccine uptake. So there's lots of things that we've learned over the past 3 years. One of the things that the government of Canada is also doing is I think we're spending up to $10 million with what we call the Immunization Partnership Fund to actually encourage initiatives that would increase vaccine uptake among maybe certain groups at risk that may not have maybe the same access to the vaccine as others. We've also learned that there's multiple ways to basically give Canadians the information they need. I think by and large, Canadians respect, understand the science, but get that information. So providing tools, for example, to the frontline providers, such as their family physicians, also reaching out to trusted leaders in the community, be it faith-based influencers. We're looking at sort of a multi-pronged approach rather than just, quote, having a few talking heads here sitting at the press conference. Thanks.
Apologies for that. Next question is from Marina von Stackelberg.
Hi there, good afternoon. You don't have the word booster here. I wanted to know, is that intentional, and are you wanting Canadians to change the way they look at getting the COVID vaccine?
I think we wanted to emphasize this is an updated COVID-19 vaccine. And similarly, we update influenza vaccines as well. And it will increase, getting an additional dose will increase your immunity, antibody levels, and also increase vaccine protection against serious outcomes. Yeah, it's a matter of terminology, but I think we're trying to standardize and simplify some of the various terms at the moment. I know perhaps Dr. Sharma has a take on that, and Dr. Tunis as well.
So yes, there's been lots of discussions amongst regulators around terminology. And so there's an internationally agreed upon simplified dosing schedule. So that's, you won't see the where's primary series as much a booster. And it's not quite stabilized yet, but the idea is that we'll get to a place where it may be much like the flu vaccine, or maybe on a regular schedule getting an updated vaccine. And so really there's more benefit. The latest vaccine, the updated vaccine years ago, very pseudo. Speaking about boosters, I don't mind the word booster because it actually does talk about what the vaccine, additional doses of vaccine do for the immune system. You take it from a place where that immunity might be waning a bit and boost it up to a higher level. I don't mind that, but again, it's really just the overall.
I can comment from the advice we've received from NACI. The committee is, I think in their statement, they maybe mentioned a booster a couple of times, but generally we're seeing a transition towards that additional dose language in line with the regulator and the authorized monograph. And there's discussion about those that are previously vaccinated, which we historically would have thought of as boosting, and then those that are previously not vaccinated. So the first dose or the primary series. And you'll see in the regulatory materials that there's that distinction between previously vaccinated or previously unvaccinated. And NACI is mirroring that in their advice and the way that the schedule discussions are going. One thing I'll note is that with this authorization for Moderna today, the NACI advice is updating, onboarding Moderna into the recommended options for this fall. We don't have the others yet. So Pfizer or Novavax are both submitted and under review by the regulator, and they might have slightly different schedules as they have so far for the previously unvaccinated or the primary series. So NACI has been working through the summer trying to look at all the products. We only have one today with Moderna, but as the others come through, we would expect future updates from NACI around what we had previously called the primary series, or for someone coming new into the vaccine schedule who was not immunized before, can NACI provide a sort of simplified, harmonized approach across the public health system for the different products. So they're continuing to work on that, and we'll see more updates coming in the coming months. I think as more products are authorized, maybe with slightly different schedules and or different nomenclature, and the committee will be onboarding that to try and make things as simple as possible, because we appreciate that the COVID-19 vaccine environment has been complex at times, and so the regulator and NACI are both seeking to simplify as much as possible in the language and the schedules.
Thanks for that. What is the timeline here? When can Canadians expect to actually be able to go and receive this shot?
Yes, so with the regulatory authorization, the manufacturer, in this case Moderna, will start mobilizing vaccines to Canada, and most provinces and territories are planning to begin the COVID-19 programs at around the same time as the influenza program. So we expect they're probably aiming for the beginning of October or thereabouts, and but that will vary a little bit, so you do have to check locally.
Thank you. Merci. On va maintenant passer sur questions sur Zoom. Vous pouvez utiliser la fonction lever la main à partir de maintenant. Use the function raise hand at this point so I can recognize you on Zoom. First question on Zoom is from Megan Delaire, TV News. You have the floor.
Hi, and good afternoon. What are Health Canada's greatest concerns around the latest variants detected in Canada?
So this is Teresa Tam from the Public Health Agency. I'll take the first go at that question. So As I've said in my remarks, the Omicron variant, these are all the subvariants of Omicron, those new ones that you've been hearing about, or descendants of the Omicron variant itself. So, and that is expected actually for a virus that's circulating in or around the world. And so we're monitoring these viruses quite closely through various means and connecting with international partners. So far, none of the recent subvariants of Omicron have demonstrated increased virulence or severity. I think there was just some latest data coming from the United Kingdom on the BA.2.86 as well, related to a outbreak. So that's generally good. None of the recent variants seems to result in more severe outcomes. But that doesn't mean that with increase in cases, you wouldn't get a significant burden on the health system or on population health. So I think it is really a matter of ongoing monitoring. But the other good news, of course, that we've also mentioned is that we expect the updated XBB.1.5 vaccine to mount antibody responses that are similar to these newest variants as it is done against the XBB.1.5. So that's good news.
Thank you.
Is that okay if I just reassure that?
Go ahead.
So, I mean, I guess the question is what to worry about for health Canada, everything, the professional careers, that's our job. But when it comes to the mutation variant, it's twofold. The one is you see these mutations, especially when we have very highly mutated. The question will be whether or not the vaccine that we're doing would have effectiveness. As well, whether or not they would pick up those variants. So, the concern really primarily around CHCH. It seems that it's going to say it's a nothing burger, but it doesn't seem like it's the one